Good evening to all. Dr. Amol.
Yes, ma'am. Yes, yes. Thank you. Welcome you. चालू करा ma'am music.
असतो मा सद्गमय तमसो मा ज्योतिर्गमय मृत्योर्मा अमृतं गमय गणनायकाय गणदैवताय गणाध्यक्षाय धीमहि गुणशरीराय गुणमण्डिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि.
Good evening, everyone. CBC is one of the most commonly asked for investigation in our practice, but it is also the most underestimated test. The normal indices also varies in a neonate from a child then to an adult. A low RBC count or HB is considered as anemia. Anemia is a rampant problem, not only in lower socioeconomic strata, but also in children from well-to families. Causes are many and so are the management. So today, Maha-IP has arranged an exclusive quiz contest on anemia and hemato-oncology. I welcome all the respected dignitaries, guests of honor, our experts of today, Maha-IP President Sir, Secretary General Sir, State Convener Sir, EB and OV members of Maha-IP, all the team members participating in today's quiz, as well as all the attendees for today's quiz program. So now, first of all, I request our Maha-IP Secretary General, Dr. Amol Pawar sir, to please welcome the guest of honor and experts. Over to you, sir.
Yes, thank you, Neha. Good evening, all dignitaries. President Gangolia sir, Dr. Nitin Shah sir, past President CIP and today's expert. Dr. Santosh San sir, past President CIP and founder President of Medical Education Chapter of CIP. And Dr. Purna Kurkure ma'am, Joint Secretary Admin of CIP, and she is also today's expert. Dr. Pinky Shah, one of the expert in today's quiz, and she has helped us in preparing the question bank, which was the most cumbersome job in arranging any quiz. And also good evening to all team Maha-IP members, Dr. Vinayak Patil sir, Dr. Mohan Varke, Dr. Jay Vandarkar, sir, today's quiz master, then Dr. Neha, Dr. Vishal, and all women committee members also, and also all the participants who happens to be office bearers of all 5 zonal branches from entire Maharashtra. This is almost a final academic event of this year. I thank all the members for participating to be in this quiz, and I welcome again all dignitaries. Thank you, Neha.
Thank you, sir. Now, I would like to welcome the guest of honor for today, Dr. Santosh Swan sir. He was president of Central IP 2018, national president, he chairperson of scientific committee IPA Congress 2023, national founder of president of the Organized Medicine Academic Guide of India, national president IIP Intensive Care Chapter 2013. Sir is founder president of IIP Pediatric Intensive Care Chapter Karnataka. Sir is founder, chairman, Indian Society of Critical Care Medicine, Canara branch. Founder, chairperson of IIP Medical Education Chapter, standing committee member, Asia Pacific Pediatric Association 2019 to 21. He has authored 5 books and many publications. Outstanding Asia Pacific Pediatrician Award in 2018. National IME Doctors Award awardee in 2019 and Governing Council member of Indian College of Pediatrics. At present, Sir is Professor and HOD of Chief of Pediatric Intensive Care and Neonatology at HA Institute of Medical Sciences and Research in Bangalore. Welcome, sir. Now the now the experts of today. Our first expert is Dr. Nitin Shah sir, President IIP 2006, Honorable Hemato-Oncology BJ Wadia Hospital for Children and at Mumbai, visiting pediatric oncologist, hemato-oncologist at Apollo Hospital, Navi Mumbai, head of department pediatrics and consultant at PD Hinduja Hospital, Mumbai. He was member of Lancet India Pediatric COVID Task Force 2021, fellow in Indian Academy of Pediatrics 2018, chair of Pediatric Hemato-Oncology chapter of IIP 2015-16, scientific chairperson of Pedicon 2019 of Pediatrics Annual Conference. He was organizing chairperson of IIP National Conference 2007, organizing secretary of IIP National Conference 2003. Sir has also was editor of many IIP textbooks on immunology, vaccines, hematology, infectious diseases in pediatrics. Our second expert of today is Dr. Poorna Kurkure ma'am. She is chairman of Oncology Collegium at Narayana Health, head department of pediatrics, oncology and BMT, SRCC Children's Hospital, and trustee in charge of survivorship program, Indian Cancer Society. Welcome, ma'am. Our third expert is Dr. Pinky Shah. She is MD Pediatrics, fellowship in pediatric hematology and oncology, IIP fellowship in pediatric hematology and oncology. She has done her fellowship from BJ Wadia Hospital of Children, intensive training in managing pediatric oncology patient at Tata Memorial Hospital, Mumbai. She has presented many papers and oral talks in national and international conferences in pediatric hematology and oncology, currently practicing in Nasik. Now I welcome our guest of honor to kindly unmute and give his blessings. Over to you, sir.
Yeah, good evening, respected President of Maha IAP, Dr. Hemant Gangolia, and dynamic secretary, because Amul, when he is, every time we meet him, he is full of energy and he wants to do something. I am sure as secretary of Maharashtra, both of them, Hemant and him, must have done a lot of great programs for the Maharashtra IAP. And also our quiz master, J. Bandarkar, I only heard him singing, but I didn't know that he's a good quiz master also. Huh? Nice to see you, Jay. So, and also my friend Nitin. I'm sure when Nitin is there, it's always exciting for the quiz to be there. I think, hope Nitin has not sort of selected tough questions for these guys. No. And our joint secretary, and our Pinky Shah, I think I'm sure that Bang, the hemato-oncologist, is is definitely going to be the star of today. I think the questions, what she's going to prepare and all that. And because this, the practicing pediatric quiz, because this was one of the, I think when Nitin was there as a secretary, I think it was a very, very sort of a popular program of IAP. I am sure this Maha IAP has started this for the office bearers. It's a very good program. And on this day, on the Hematology-Oncology subspecialty, I am sure this will be a great this thing. I won't take much of time for you. All the best for the participation. Winning or losing is not the main thing. I'm sure you all have studied. That itself is a major thing, because otherwise you wouldn't have gone through all those things to read this hemato-oncology subject in that depth. I'm wishing you all the best. And I think when Hemant and Amol and the secretary, the treasurer, when they look back, I am sure last 1 year has been very fruitful, because 2 years after the COVID, I think this is 1 year has been so much sort of so many programs coming in. I'm sure. I think congratulations for the whole office bearers of Maha IAP. I think congratulations. Thank you so much for calling me. Thank you.
Thank you so much, Santosh sir. Now I would request Dr. Nitin Shah sir to say few lines. Over to you, sir.
Well, I think we have all gathered here for the quiz to start, so let's not too much take away time in these formalities. I can only say, Neha, that I'm sandwiched between my teacher, Dr. Purna Kurkure, and my student, Dr. Pinkisha. And I'm sure both of them are more learned than me. So I have actually joined here not as an expert, but to learn hemato-oncology. So let's just start with the quiz and get to the teams. Thank you.
Purna ma'am, would you like to say something? Over to you, ma'am. Kindly unmute, ma'am. Ma'am, you have to unmute.
Madam,
Hello?
please unmute yourself.
Madam, unmute kara.
Pallavi madam, permission दिली है?
हो सर आहे.
करतायत.
Unmute करा
He is
था
doing.
madam.
करतायत.
Hello,
Yes.
can you hear me?
Yes, ma'am.
So as Dr. Nitin said that he's sandwiched between his teacher and a student, I would rather say that I am facing a person who is considered as a master of all in benign hematology and particularly anemia. So I'm sure this session is going to be very interesting with his presence around. So let us begin without much ado. Over to you, Neha, to continue with the proceedings.
Thank you so much, ma'am. Now I would request our third expertise, Dr. Pinky Shah, ma'am.
Yeah, hello, good evening, everyone. Thank you so much for giving me this opportunity to prepare the questions and coordinate the quiz. As I want to say thank you. Nitin Shah sir is my teacher in Wadia Hospital, and Kurkure madam is my teacher in Tata Hospital. So I'm sure today I'm learning much more things from them rather than I teach them. So let's start the quiz without wasting any time. Yeah, thank you.
Thank you so much, ma'am. Yes, I would now hand over the mic to our president, Dr. Hemato-Oncology sir, and state convener, Dr. Jay Bhandarkar sir, to start the event.
Thank you very much. And Maha IAP presents a quiz on anemia and hemato-oncology. This is World Anemia Day is on 26th November, and in view of that, we have organized this quiz on this day of 6th December. And our experts are, as already said by Dr. Neha, it is Dr. Nitin Shah sir, Dr. Purna Kurkure madam, and Dr. Pinky Shah madam. And I feel that it is all that Guru and Shishya, Guru Shishya ऐसे. तो Guru कौन गुड़ है कौन शक्कर है मालूम नहीं है पता चलेगा. So this is all the expert we are having having. And of course now we are having 5 teams. The first team is Mumbai Konkan team. and it is represented by the team leader, Dr. Anjali. I will request Dr. Anjali, please introduce our members and
Hello.
yourself.
Yeah, can you hear me?
Yes, go ahead.
Yeah, I'm Dr. Anjali Gokarn. This is Dr. Vaibhavi Parot, and this is Dr. Anuradha Palwankar.
Thank you very much. All the best. We have team North Maharashtra. So I will request team leader Dr. Nishat Madam to introduce herself as well as her team members.
Yes, I'm Dr. Nishat Rangles, a pediatrician and working pediatrician and neonatologist. With me, my friend Dr. Shamal Jain and Dr. Praveen Patil.
Thank you, madam. Our third team is Team West Maharashtra. Team leader Dr. Shilpa Madam. I will request her to introduce herself as well as the team members.
Myself Dr. Shilpa Hirugade. माझ्याबरोबर श्रद्धा मॅडम आहेत आणि प्रमा मॅडम वेगळ्या ठिकाणाहून जॉईन झालेले आहेत.
धन्यवाद मॅडम. आपलं next team is team Marathwada, and I will request Dr. Mahesh sir to introduce himself as well as his team member. Dr. Mahesh.
Myself Mahesh Bhatamre, and with me only one my colleague is there, Rahul Patil. Rahul Gaikwad.
Okay. And the last team is team Vidarbha, and it is I will ask team leader Dr. Rafiq to introduce himself as well as his team members. Anyone is there from Vidarbha, please? Anyone from Vidarbha? Piyush, Venkat?
Venkat sir. Hi, join it, sir.
So we have Dr. Rafiq as a team leader, Dr. Piyush sir and Dr. Venkat as a team members from Vidarbha, and hope so they connect with their audio henceforth as well their turn comes. So with this, we come to the introduction of the teams. Now we go to the naming ceremony. Actually, what is this naming ceremony? We have designed a PPT in the 5 teams, and we have given the 5 names to these 5 teams. And we should not be biased. Therefore, we are renaming this team, whatever the 5 teams we have. So we are renaming the team. And for this, we have our guest of honor, Dr. Santosh sir, to do the honor of renaming the team. So I presume that sir is ready with the bowl with the cheats of the these teams of Mumbai, North Maharashtra, West Maharashtra, Vidarbha, and Marathwada. Dr. Santosh sir, are you ready, sir?
I am ready. I am shaking the kids. Okay.
Yes. So thank you very much. So our first team name, the new name for the new team is Anemia. And for this Anemia, I will request speaker one of the lords and to just tell me which team is this Anemia.
This is Vidarbha.
So Vidarbha team, captain may respond, team leader may respond. What is your new name? Vidarbha, please. Anyone? So Vidarbha is Anemia. Our next name is Leukemia. So sir, please.
That's a terrible name.
North Maharashtra.
So North Maharashtra.
Yes, sir.
Our team name is
Leukemia.
That's a very malignant name, I would say.
Yeah, poor prognosis.
Poor prognosis.
Third name is Thalassemia. So sir, please let us know which team is this.
Mumbai and Konkan.
So Mumbai Konkan team leader, please acknowledge your new name.
Thalassemia.
Okay. So our next name is Sickle. So Santosh sir, please do the honor
Yeah,
of.
Marathwada.
So Marathwada is Sickle team. And of course the last, whatever the name is there, the remaining team will be that. It is a megaloblastic.
Yeah. Western Maharashtra.
So Western Maharashtra. So sir, with few words, you can just comment on these names as well as you can just inaugurate the new naming ceremony.
Yeah. So it's so nice and something different by naming the team like we have for the cricket, different Bangalore Royal Challengers and all that. That type of name is there. So like that, I think it makes it more exciting and quite a nice idea to give this name. With this, I would sort of declare open this, to start of the quiz and all the best for all the participants. Thank you.
Thank you very much, sir. So to
Thank you,
reiterate,
sir. Thank you.
anemia is Vidarbha, leukemia is North Maharashtra, thalassemia is Mumbai Konkan, sickle is Marathwada, and megaloblastic is West Maharashtra. With that, we move our quiz program. Before that, we have just 2 or 3 minutes of rules and regulations. I will request Quiz Master Dr. Jay to explain the rules in short. Yes, Dr. Jay.
Yeah, good evening. Welcome to all experts and our guests and our participants. So, if quiz is there, there will be rules and regulations. So, the 5 teams, each 3 members in each team, and team name already known. So, there will be the 3 rounds in this quiz. The first round, so we will be calling each time and going to ask 4 questions at a stage. There will be 10 points for the correct answer, and 0 points for the wrong or no answers. Time duration for each is will be 15 seconds. And please remember, when I said this question to you on the dais, the team only will be attending or attempting will be their video and audio on. Other team will keep their video audio off also. And second round also will be same. There will be 4 questions at a stage to each team, 10 points for the correct answer and 15 seconds. And most important thing, there will be, when I say that your time starts now, then and then you start speaking, not before that. Because suppose you start discussing when I put the question, so we were not able to hear properly the question because I'm going to say all the options also, right? That is very, very important thing. And last round will be the third round, that is the rapid fire. There will be 6 questions maximum or 60 seconds, which are early, and there will be 5 points for each question. And most important thing, please attend only 1 person. You can discuss, but in rapid fire I will attend just who is going to attempt that 6 questions, so that you can attend all the questions. And there will be a tally of the all marks at the end of 3 rounds. And suppose there is a tie between the 2 teams or all 5 teams, there will be tie question. There is 3 tie questions to each team. And mind you, the quiz master decision is final. And experts are there who are very stalwart experts. Dr. Nitin Shah sir, Pura Kurkure madam, and Pinky. She has helped to set the questions, as well as I have set the questions also, case based. And if there is some ambiguity, Nitin Shah will go to experts. And there's no arguing on the dais about this. Yes, in a personal we can very well, because our quiz, is very famous, and it is very much liked by the people, and it is attended by a very large audience also. So I congratulate all of you, and all the best. And most important, suppose somebody log out, don't worry about that. Whoever present here, they should attempt that questions. And though I return the 15 seconds, you get a lot of time, because the timer is proper. And most important, the all final PPT is done by Dr. Hemant Gangolia, and all these techniques and other things, music and timer, I provide him, he put in the PPT. So almost like patent of MyIP quizzes by the Dr. Hemant Gangulia sir, and doesn't charge to us of MyIP. Both of us have wasted lot of, I cannot say wasted, but creativity has done the last 2 years. So I enjoyed the preparing the quiz and doing that. So thanks to Amol, every time he organized he said ki sir quiz करायचा है, तो teams तैयार कर. Teams, guest of honors, experts. And all this communication done usually by the Amol, and I just give the final touch, and final PPT is usually done by Hemant Gangolia. Then Dr. Neha is always there, Dr. Vishal to all the flyer, and other teams also helps, and you are our office bearers of the MyIP, as well as the office staff, Datta and Shiva. They both are also helps to for the many things in this. So thank you all. We know we're at the end of our last year, I think year end. So thank you. So I think we should go ahead with the quiz, and everybody should remember their name. Now I will not calling with you will name like the anemia and thalassemia and megaloblastic and leukemia. Please remember your name and call on the dais. Thank you, step by step. Thank you very much.
Dr. Jay,
just one clarification, Jay. One is that there is no pass on round, right?
No pass, sir. Question is direct.
Yeah,
there is no pass to other team. No.
Yeah, and the first answer given by any of the team members.
Yes, most important, the answer, the team leader.
They can discuss and give final answer.
They can discuss, and before timer stop, the team leader should give the answer. Yes, my answer is A or B, whatever. So I will take
No, but
first answer.
one answer is given by one of the team member, the other cannot correct it. That's what I'm trying to say.
Suppose team leader should be give the answer. They can
Correct.
discuss it. Team leader say आमचा answer हे आहे, तर
Perfect.
तेच final.
Perfect.
एक answer you cannot revert back. Please
Correct.
remember. Thank you very much.
Perfect.
So this slide explained whatever the sir has asked. There will be no passing of the question from one team to another. It goes unanswered. First answer given addressed to the quiz master, preferably by team leader. Within the student will be registered, and final answer as far as possible. Start my answer is, and you can give the option as well as the read the option, whatever. Before we start, we would like to thank Dr. Pinky Madam to give all the questions whatever was given. But we had made some changes. Dr. Pinky, if you don't mind, we had made some practical questions put into that. And of course, we got a less time. Otherwise, we would have made much more interesting, more practical what we practice. But because the time short, we could manage whatever is possible for the best. So please excuse for us for that. So moving ahead. So this is round 1. So we invite team Anemia. So which is a team Anemia? Dr. Jay, because I'm sharing the screen, I may not be able to see all the videos.
Team Vidarbha, are you ready?
Check it out.
Yes, sir. Acknowledge yourself. When you I take your name, Anemia or Vidarbha, if you take it, who is the team leader?
Yes, myself.
So your name, please, sir.
I'm Dr. Rafiq Mawani.
So Dr. Rafiq, I will going to concentrate on you. You are going to finalize answer. Please see that you start giving answer before the timer stops. Are you ready, sir? Rafiq, sir.
Yes.
So is the first question, or I think 2020 will start today. The first question on the dais for the team Anemia. The first question for you on the dais. According to National Forum of Hematology Society 29-21, anemia prevalence in children between 6 to 15 months under 5 is option A 52%, option B 67%, option C 49%, and option D 75%. Your time starts now.
67% B.
Okay, B for Bombay, you're saying?
Yes.
Okay, so B for Bombay is you are locked because the team leader instead confidently played the first ball. So let us confirm with our answer machine then. Yeah, bingo, fantastic, congratulations. Nitin Shah, sir.
So just one correction. This is national. Okay, so this is National Family Health Survey. It's not Hematology Society.
National Family Health Survey.
Yes, they are done nationally every 5 years, and then they compare with the previous. So currently the NFHS 5 data, and that shows that from NHS 1, 2, 3, 4 to 5, incidence anemia has hardly moved.
Right.
So that is a really irony that we are abundant with iron around us, but iron is so deficient in our own body.
Right. Thank you, sir. And sir, I have also read, but the causes other than iron deficiency, megaloblastics are more also there. Almost 30 to 40% are almost other causes also there.
So NFHS data does not collect on the type of anemia. It just says how many are anemic. But there is another survey which is done to look at also the types. So they do also electrophoresis, ferritin, other things. And they find that iron deficiency is still the commonest cause, around 60%. Around 15-20% with megaloblastic, around 5 to 10% will be thalassemia minor or major or sickle or hemoglobinopathy, and some which are not identified as to what the cause is.
Okay, sir. Thank you. Sir, moving on to the second question. Congratulations, team Anemia.
Dr. Jay, any expert, if you wants to say something, they can intervene in between. Dr. Jay, please give the attention to the experts if they want to say something.
Okay. So is the second question for the team Anemia, Vidarbha. On the dais, please. A newborn CBC reveals hemoglobin 11, MCV 106, WC 12,600, platelet 2,96,000, and reticulocyte 2%. The most likely diagnosis, the options are A, anemia prematurity, second, iron deficiency anemia, C, G6PD deficiency, and option D is it is going to normal. So time starts now.
Fifth option.
Start kara timer.
The answer is A.
Okay, so team leader has answered is the anemia of prematurity in the newborn with this CBC. So let us confirm with our answer machine. Gangulia ji. So it's not anemia prematurity, it is normal. So expert Nitin sir, please explain something about the anemia prematurity. Suppose because Rafiq sir has answered this.
Correct. So anemia prematurity is a term which is used for a preterm baby who is normally born with actually more higher hemoglobin than a normal child, like a normal full-term child. But as the age advances, because the erythropoietin kick that should start after birth doesn't happen, they become more and more anemic. So the marrow is not responding to the anemia, and the hemoglobin may fall to as low as 6.5 to 7 grams. Most of them are asymptomatic, some are symptomatic and needing treatment, but if they're asymptomatic, we just leave them alone. So that typically seen around 6 weeks of age after child is born preterm. So that's the anemia of premature. This is at birth, I suppose you asked, right?
Yes, sir. Okay, thank you. Point well taken. Sir, moving on the third question. What is the RDW in CBC parameter? Options A, index of variation of reticulocytes. B, index of variation of RBC HB concentration. Option C, index of variation RBC size. Option D, none of the above. Your time starts now.
The answer is C, index of variation of RBC size.
Okay, so I registered the answer because team leader has confirmed that answer and answered even within 3 seconds. I think going to right. Let us confirm it. Himanji, yes, perfectly right, sir. It's the index of variation of RBC size. Thank you.
So this is what we call coefficient of variation of RBC size. So what I see as anisocytosis under microscope on a peripheral smear examination, this is subject to confirmation of the same by the automated red cell counters. So automated cell counter has the advantage of giving this RDW, which is of course not seen in nowadays in most of the counters, but some old counters may not have, but most of the counters should have it. And it has a tremendous advantage of classifying anemia. We'll come to this a little later because it may be part of some question.
Okay, sir. Thank you. Sir, moving on the fourth question. Team anemia ready?
Yes.
With the spot, we will going to have a picture on the dais or on the screen where to give the diagnosis. This is a peripheral smear. Please, Dr. Hemant, post. Please watch it carefully. 1, 2, 3, 4, 5. And your time starts now.
Target cells. Yeah, hello.
Please, timer.
Target cells.
Okay, I raised as a target cell. Let us ask our expert, Nitin sir.
So
Pinky.
you can see, Achha, okay, Pinky can answer.
Yes,
Pinky wants to
Pinky
answer?
madam, please. Unmute, unmute. Please unmute yourself.
Yeah, you can see the bluish spots in a RBC, and so target cells having a typical central dark and otherwise whitish. So it's look like a target cells, but here we cannot see target cells. Inoculations, that spots, bluish spots in a RBC. So it can be Nitin Shah sir can answer this PS expertly.
So you can also see the large cells which are blue. Okay. This is what you call polychromatophilic cells. Right. This will be seen also as reticulocyte on a peripheral smear. So this child has also high retic count, I can tell you that. And there is some hemolysis going on. All these blue spots in the RBC could be malarial parasites.
Yeah. So Nitin Shah forgotten the task of houseman. एक peripheral smear घ्यायचा आणि microscopy बघायचा. बरोबर आहे ना? स्वतः confirm करायचं.
And when you see multiple ring forms,
yes.
Like falciparum malaria, if you see single ones, then that is Vivax. And also in falciparum malaria, somewhere you will see a banana-shaped gamete, which will confirm the diagnosis.
Thank you, sir. So this is a very common slide, very common, I think, diagnosis. So team anemia completed their 4 questions. So what is the score? I think they have scored 20 marks at the end of first round. Right. Thank you, team anemia. And all the best for the next team is team leukemia from North Maharashtra. Team leukemia, are you ready? Yes. And please take your names.
Yes, sir.
Dr. Shamal.
Dr.
Yes, sir.
Nishad
Yeah.
and Praveen.
Are you ready?
Dr. Praveen.
Yes, sir.
Yes, sir.
Okay. Yes. So here the first question from the quiz bank, Dr. Hemant, on the dais for you. A 7-year-old boy appears with anemia. The laboratory studies reveal that the hemoglobin is 8. Hematocrit is 24%. Reticulocyte count is 14%. The blood smear reveals many spherocytes. The child's blood type is B positive. The physical examination reveals massive enlargement of spleen. The appropriate management is, your options are A, iron therapy, B, vitamin B6, C, vitamin B12 therapy, D, splenectomy, and E is observation. Your time starts now.
बोलना है तो अपने
D.
Splenectomy बोलना ना कि observation.
D.
Splenectomy.
D, sir. Our answer is D.
Okay, so Dr. Shamal, you are answering D, team leader. Okay, I will log that answer, splenectomy.
Yes, sir.
Okay, let us confirm our answer, Guru. Yes, yep, bingo. So it's a case of hereditary spherocytosis. Very simple one, maybe. The splenectomy is a treatment of choice. Nitin sir.
Yes, that's
Are they correct?
Because the spleen
Yes.
is massive inside. If the spleen was not massive, I would have left the child alone only on folic acid.
Okay. So
Because he's keeping good hemoglobin.
yes. So congratulations to team North Maharashtra leukemia. So let us move with the second question. The switch from fetal hemoglobin F to hemoglobin A is delayed in infants. In which following are the conditions: infant of diabetic mother, B, propionic acid metabolic disorder, C, bronchopulmonary dysplasia, D option all of the above. HbF to HbA. Your time starts now.
D, sir.
D, all of these.
All of them.
All of these. या फिर प्रोपियोनिक एसिड क्या करना है डी के
5, 6,
CD.
3.
D.
Answer
D,
please.
sir.
Huh?
D, sir.
Which
D,
answer
D.
please? D. D for
Yes,
doctor. Okay. Let us confirm
Yes.
with Hemant sir.
Dr. J, B or D? They
D,
said
D, D,
or
D, D.
D for
All
doctor.
of the above. All of the
All
above.
of the above.
Ah.
Yeah. Bingo. Perfectly right. So congratulations to team leukemia. They are banging on each even second ball also. Yes.
Any comment? Any comment, Jay?
So when does the normal switch happen? Team, let them a subsidiary question, bonus question.
So they will be quiz of the quiz.
When does the switch happen? And when does the switch get over?
Yeah.
The switch happens in utero in the
6
last
months.
trimester, and it's completed by 4 to 6 months of age. That's why you don't look at hemoglobin F level before 6 months. In a thalassemia major, you always do electrophoresis after 6 months. And why does the switch does not happen? Any stress marrow continues to produce HbA. In front of diabetic mother, propionic acidemia, all these are children who are under tremendous stress, and that's why the switch takes longer time to complete.
Okay. Point well taken. So moving on the third questions. So team leukemia ready? The feature of hemorrhagic newborn disease is options: a prolonged bleeding time, prolonged thrombin time, option C, prolonged prothrombin time, and D, prolonged clotting time. So hemorrhagic newborn, these are the options. Your time starts now.
Sir, answer is C, prolonged prothrombin time.
Okay. So very confidently they are C for cat. Let us confirm with our answer machine. He's smiling, maybe right. Perfectly right. Yes. Sir, Nitin sir. Yes, we know the vitamin K. Yes,
so
sir,
I have
please.
one question for the team again. And if you have a older child, say 2-year-old child who's bleeding, and you see only prolonged prothrombin time and a normal activated partial thromboplastin time, that is APTT, what is your diagnosis? Not in a newborn, in an older child.
What is
Isolated
factor.
Yeah, which factor?
Factor 13 deficiency.
No.
And then 7 common factors. Common 7 factors. नहीं.
Factor 7, correct. That's the answer. Perfect.
अरे वाह, मैं सर मार्क नहीं दे सकता लेकिन perfect है.
नहीं, ठीक है. मेरी तरफ
Sir,
से
what is the
mark.
policy? Can you by birth you get
So
the vitamin K?
when you have a newborn who has got bleeding from GI or cephalometoma or intracranial hemorrhage in an otherwise well-looking child, we're not suspecting DIC, sepsis, etc. The common cause would be, of course, hemorrhagic disease of newborn. So there, if someone has already given vitamin K and FFP and then sent to you, you may get a normal PT and a normal PTT, everything is corrected. So in hindsight, how will you diagnose that it was still an hemorrhagic disease of newborn? You do what is known as PUCA. You do the proteins which are created in absence of vitamin K, correct?
Yeah.
But if a patient comes fresh to you and you do his bleeding profile, you find the PT is prolonged, APT is normal. In a setting like this is typical HDN. If the child is not bleeding majorly, you give vitamin K and C. If the child is bleeding, then you also give FFP. If it's a preterm child, alone vitamin K is not enough. You have to give FFP because his liver may be immature and may not be able to produce the clotting factor 2, 7, 9, and 10.
Thank you, sir. So moving on to the fourth question. Steve Likime, are you ready for fourth question of your? Yeah. Just spot for you on the screen.
Yes, sir.
The peripheral smear for you
Target.
on the screen, and you have to diagnose this case, right? They are the peripheral smear. What is your diagnosis? Your time starts now.
body. Can you see?
नहीं ना, टारगेट सेल जैसे दिख रहा है ना, छोटे-छोटे सा आरबीसी और वो क्या है, जल्दी बोल. और वो इधर वाला क्या है, हाइपर सेगमेंटेड न्यूट्रोफिल. नहीं यहाँ पे जल्दी बोल. आयरन डेफिशिएंसी. माइक्रोसिटी में बोलते हैं.
एक्चुअली टाइमर स्टॉप होने के बाद में आपसे कुछ आंसर आया था, लेकिन अगर राइट देने से बिकॉज टाइम वाज not there. So let us confirm what is the answer from our answer machine. पर timer चालू झाला. Yes. Actually, you delayed by 2 seconds only. So the IDFC anemia microcytic hyperchromic very I think what yes sir. बराबर है sir ये?
So I mean, if you ask me, actually you should change this question because this is not a typical iron deficiency smear at all. I would say actually a normocytic normochromic picture, and all it shows is an RBC and a platelet and a lymphocyte. So this is not a typical. I mean, if your rules permit, you should change this smear and give them another question.
So thank you, sir. Yes, sir. So we'll change. We're going for another extra question. है का हेमंत जी तो भी दिलेला.
Dr. Jay, because it is not kept in the PPT, it is separate. So you have to go to the next question. But then what we will do, we will ask Dr. Nitin Shah to ask one of the question verbally. We will not display and timer will start again.
Okay, sir.
All right. So, so the teams are there?
Yes, sir.
Okay. So what is iron challenge test in the patient of suspected iron deficiency anemia?
Sir,
also called as therapeutic iron test.
We can give if we give therapeutic doses of iron, if there is an improvement in appetite and retic count.
Complete the treatment. I will not allow you to. You need to give me three at least part correct.
3 part correct.
Okay, anyone wants to try? No? Okay, fine. So iron challenge test.
Sir, 1 minute. Sir, 1 minute. They have started answering. So whatever the 3 points sir wants, if we give the chance to tell you, you can tell.
24 hours.
No, they have not given.
Increase appetite.
Okay, okay, sir.
So you said increase appetite.
Sir, within 24 hours.
Increase appetite.
Decrease irritability.
Decrease irritability and
within 40 to 72 hours, increase reticulocyte count.
Increase in reticulocyte count within 48 hours.
And peak up to 7 days. At peak level 7 days.
Okay, so that's not the correct answer. The correct answer is that they have reticulocytosis between day 5 to day 7. They have hemoglobin rise of at least 1 gram at the end of first month, and they have normalization of the hemoglobin at the end of 3 months. That is what is a typical iron deficiency treated with iron challenge test. And if this happens, in hindsight, you know it's iron deficiency, otherwise not.
Okay. Thank you,
I
sir.
think we cannot grant it because they just said only part of the.
Yeah, thank you. So psycho team leukemia, they scored 30 marks. So next team is the team thalassemia, Mumbai Kokan. Anjali Gokal madam ready आहात बरेच वेळ वाट बघताय.
Before the Jai, I want to tell that see, leukemia was saying poor prognosis. Now today with the protocol that we have, leukemia has got very good prognosis. That's why they scored 30 marks.
Yes, sir. Thank you. So team Mumbai Kokan ready?
Yes.
Yes. So team leader अंजली मॅडम तुमच्यावर मी लक्ष ठेवणार आहे. तर हा पहिला बॉल तुमच्यासाठी स्क्रीनवर डॉक्टर हेमंत आमचे जे क्वेश्चन बँकर आहेत. Please on the dial. What is the normal reticulocyte count at birth in a full-term baby? Options are A 10 to 12%, B 1 to 2%, C 2.5 to 6.5%, option D 5.5 to 9.5%. Your time starts now.
Our answer is B, 1 to 2%.
Okay, we will not reveal the answer. Yes. Team leader 1 to 2% in a new full-term baby. Okay, let us confirm our answer. Answer machine is 2.5 to 6.5%. Sir, I am right?
Yes, you're right. Because see, newborn is a stress baby, and the marrow is stress at birth. So marrow will always throw immature cells, including reticulocyte, and sometimes even nucleated red cell in a completely normal baby. So the retic count up to 5% is normal in a newborn baby. So other way, if you have a child with anemia with jaundice and you're worried about hemolysis, if your retic is 3%, don't jump into conclusion is hemolytic anemia. It has to be above 5%. So this 2.5 to 6.5 is the correct answer.
So these are somewhat tricky questions where to answer about the pediatric patients, not the
and this
newborn.
retic falls to normal level by day 5 to day 7.
Okay, thank you, sir. So we are moving ahead with the second question, team Mumbai Kokan. Somewhat different question. The cell count on the cerebrospinal fluid specimen should be performed as soon as possible after collection of, because the cell begin to deteriorate within dash of time of collection. Your options are 30 minutes, B 1 hour, C 2 hour, D 12 hours, and option E is 24 hour. Your time starts now.
Five seconds.
2 hours. Our answer is 2 hours.
Okay, let us confirm your answer machine. Hemant sir. Is only 30 minutes, because why I put this question, because it's very important to do CSF examination at the earliest. Sir, I am right or not wrong?
So, I mean, this is again a dicey situation. You can actually look at up to 2 hours. So that is the correct answer. But yes, earlier the better. I suppose this is CSF fluid specimen cell count for a child suspected leukemia. I have to know whether there is CSF involvement.
No, sir, for hematology.
Correct. So in oncology, you do CSF only to see CNS involvement in leukemia, and where the cells may deteriorate. But I would say up to 2 hours is okay.
So we'll give to them.
I would agree with Dr. Nitin.
Yeah.
Because
I think we
earlier
should
the
give them.
better is okay.
Yeah.
But 30 minutes is
impossible.
Logistically not possible, and it is not that much deteriorated not to identify an abnormal malignant cells.
Okay.
So
Okay.
2 hours should be good enough.
I think we should give them.
Okay. Yes. Thank you, sir.
Sorry. Yes.
Yes, sir. Congratulations, team. Gokal madam, आपको मिल गया mark. Are you ready for the third question then? Yes. On the dice for you. The fresh frozen plasma transfusion is the best treatment for which of the following conditions? Your options are A. Hemophilia A, hemophilia B, factor 7 deficiency, immunoglobulin replacement therapy, and option D, bleeding due to warfarin therapy. Your time starts now.
Our answer is C, factor 7 deficiency.
Yes. Please, Hemant sir, don't reveal the answer. I will. So you already received the reveal kara answer. Kara reveal kara. Is bleeding due to warfarin therapy? Nitin sir, फ्रेश प्लाझ्मा पण अवेलेबल आहे, क्राय प्रेसिडेंट कित्येक बाकीचं अवेलेबल आहे, तर ते वापरायचे का या कंडिशन हे
So
वापरायचं?
FFP has all the clotting factors. Okay, so it can be used for the first time when an unknown bleeder comes. You don't know what is hemophilia A, B, whatever. So you used to tide over the crisis. But if you know that is hemophilia A, you should put factor 8. If it is known hemophilia B, you should use factor 9 or cryoprecipitate. Don't use cryoprecipitate. And if it is factor 7, for cryoprecipitate only has factor 8. So it should be only for hemophilia A. So hemophilia A is factor 8 of cryo, hemophilia B is factor 9. Factor 7 deficiency, you can use factor 7, which is available. Immunoglobulin therapy, you should give IVIG and not give FFP. So the only way there are multiple factors which are gone, like warfarin, which will induce vitamin K like absence, like so 2, 7, 9, 10 factors. That's the time when you can give in a situation like that.
So what typical critical question or difficult question?
Very difficult
Okay.
question.
Thank you.
No, it is how you interpret.
Right.
Yeah, exactly.
It depends on the interpretation of a thing, like known patient with a bleeding, unknown patient.
But when he says the best treatment, which means in hemophilia, I mean the diagnosis is known.
Yes.
Then you will not use
Right.
FFP,
Right.
like that.
Thank you, sir.
अभी लास्ट क्वेश्चन थोड़ा इजी देना.
काय देखो ये रैंडम आहे ते. So we are here to all win over the knowledge and gain the knowledge from the expert and the discussion, not about the losing and winning.
Yeah, but
Fourth question for you.
थोड़े पॉइंट्स भी मिलने चाहिए ना.
Yes, points will get. Discussion के 100 points will get आपको. So the fourth spot for you on the screen. Yes, this is a smear, and your time starts now.
Megaloblastic. Is a one yeah, blast cells in peripheral smear. Leukemia.
Okay, let us have this.
And if this is wrong, you have to give us one more. Nitin will have to ask us.
Perfect. You should get double the mark.
Answer machine, please.
No, before let sir explain, na? Then we will answer.
So this is
cytoplasm.
So you can see these are all the large cells. So they are mononuclear. Now mononuclear cell can be either lymphocyte or a blast on a peripheral smear. Now lymphocytes have a dark nucleus like an ink dot. This is an open nucleus, what you call sieve-like nucleus. So this is a cell which is going to fragment. Other thing you see, there is hardly any cytoplasm and there are no granules in the cytoplasm. Most of the cells are very similar to one another. So it could be either a typical ALL or an M0AM. Most likely to be ALL.
Okay, so this is the blast cells. Thank you very much, team Mumbai Konkan.
Yes.
Bang on the target this time.
This was a very difficult one, but we got it.
Okay, 1 minute. So I will ask. This is this quiz is fun. So suppose are you able to see my cursor? No, right?
No.
Sir.
Okay, then
all this.
If all these cells, you can see one cell which has these bubbles in the left-hand corner.
Yeah.
Yeah. If suppose all the cells have that type of picture.
This one,
right?
This
yes,
one.
sir. Yeah.
This one, sir.
That one. So if all cells have similar picture and even more, then what would be the diagnosis? Leukemia, yes, but which one? That we Burkitt's leukemia or a L3 morphology as we call, where there are vacuolation in the cytoplasm.
Vacuolation.
So it's so typical that you can make actually a smear of a lymph node, stain it, and you can make a diagnosis in 1 rupee smear bedside without any histopathology, without any IHC. Yeah, this is Burkitt's disease.
Also, there is a Nitin. There is a very pseudopodia-like prolongation of cytoplasm.
Yeah.
Which is pushed basically by the large nucleus.
That's right.
That is also one of the characteristics.
So, एका प्रश्नामध्ये 4-5 उपप्रश्न झाले. Thank you very much. We got a lot of things. So, team, congratulations.
The idea is to also learn, not only win quiz, right?
Yes, sir. So, team, this
20.
Mumbai Konkan has scored 20 marks. Congratulations. Thank you for attending all the questions. So, moving ahead with the team Sickle, Marathwada. मला सिकल मराठवाडा जास्त आहे तिकडे मॅच झाले त्यांचं जरा नाव. मराठवाडा टीम रेडी?
येस सर, रेडी.
विथ द टीम लीडर महेश सर, मी तुम्हाला तुमच्याकडे बघायचंय मला.
राहुल, both of had emergency sir. Myself is there sir to fight.
Yes, अखिला तेंडुलकर काफी है. Yes, so here's the first question for you on the 9-month-old child with hemoglobin concentration of 10 gram% marked microcytosis. Serum iron and total iron binding capacity are within normal limits. Serum ferritin, hemoglobin erythropoiesis are also normal. Of the following, the most likely diagnosis is option A, iron deficiency anemia, option B, sideroblastic anemia, option C, beta thalassemia minor, option D, alpha thalassemia trait, or E, anemia due to chronic disease. Your time starts now. हिमोग्लोबिन कमी आहे आणि बाकी सगळं नॉर्मल आहे त्याच्यामध्ये.
डॉक्टर जय थोडस 1-2 सेकंड त्यांना
हो जास्त देत काही प्रॉब्लेम नाही.
टाइम विल स्टार्ट
हो परत रीड करून घ्या. 9 months old 10 gram% मायक्रोसायटोसिस आहे बाकी सगळ्या गोष्टी नॉर्मल आहेत. ओके युअर टाइम स्टार्ट्स नाउ. Answer something please.
No, sir. It's E, sir.
ओके टायमर ऑफ झालाय. आता टायमर गेल्यानंतर आता तरी तुम्हाला एक असा चान्स असं म्हणलं तुम्ही दिला असेल मार्क नाही मिळणार पण कुठला ऑप्शन असू शकेल. सिंपल आहे कारण बऱ्याच गोष्टी नॉर्मल आहेत त्याच्यामध्ये. इलेक्ट्रोफोरेसिस नॉर्मल जे बाकी हिमोरेटिक अॅनिमिया रूल आउट झाला. आयर्न आणि सगळं ते पण नॉर्मल आहे. आयर्न डिफिशियन्सी अॅनिमिया रूल आउट झाला. मग राहिला कुठला क्रोनिक डिसीज मध्ये तर नो. So let us reveal the answer from the answer machine.
रिव्हील करू का पहिले
हा
विचार
करा एक्सपर्ट आपला एक्सप्लेन करतात. इट्स अल्फा थॅलेसिमिया ट्रेट. सर मॅडम पूर्णा कुरकर मॅडम नितीन सर.
So when you have an extreme microcytic hypochromic picture and a normal ferritin electrophoresis, it rules out beta thalassemia trait and iron deficiency. Sideroblastic anemia is very rare, and anemia of chronic infection again will have high ferritin. So, and it will have a low TIBC. So, all these not fitting. The typical what you see is on a smear is what you call alpha cell. So you'll see a lot of basophilic stippling in some of the cells, and you will see this typical microcytic hypochromic.
Okay, thank you, sir. So moving ahead with the
So
second question.
This is a tough one. This is for
tough
And
one.
actually, this can be diagnosed by the genetic mutation studies.
Absolutely.
So
The only way, once you suspect, ask for genetic diagnosis trait.
Moving ahead with the second question. In which of the following conditions reticulocyte count is low or normal? Options Rh isoimmunization, B congenital hypoplastic anemia, option C G6PD deficiency, and D hereditary spherocytosis. तर रेटिक्युलोसाइट हा लो किंवा नॉर्मल आहे या 4 कंडिशन्स मध्ये. युअर टाइम स्टार्ट्स नाउ.
स्टार्ट करा साहेब.
It's a congenital hypoplastic anemia, sir.
ओके सो युअर ओनली लीडर तुम्ही एकटेच आहात त्यामुळे ते मला तेच मार्क करणार आणि बहुतेक तुमचं आन्सर कन्फर्म करूयात आपण. येस इट इज अन कॉमन सेन्स सिम्पल कारण बाकी सगळे हिमोलायटिक डिसऑर्डर आहेत तर ह्या गोष्टीमध्ये खरं तर ते रेटिक्युलोसाइट नॉर्मलच यायला पाहिजे. सर नितीन सर आमचा आन्सर बरोबर आहे का?
यायला पाहिजे.
नॉर्मल यायला पाहिजे.
So reticulocyte count is a window to the bone marrow. So high retic would be in a marrow which is regenerative to the cause of anemia.
Yeah.
And low retic would say a disease marrow. So obviously of this, the marrow is disease only in hypoplastic.
Yes. The answer is B. Sir, Hemant sir. Congenital hypoplastic anemia. Perfectly right. You have scored 10 marks. Thank you. So moving on with the third question for you. Dr. Which of the following is not a macrocytic anemia? Options are which of the following is not macrocytic anemia? Option A vitamin B12 deficiency, B orotic aciduria, C thiamine responsive anemia, and D again came the alpha thalassemia, which is not a macrocytic anemia. Your time starts now.
Alpha thalassemia, sir. D.
Okay, answer आलाय लगेच. चला रिव्हील करून टाका.
That is very good. It has one answer and led to another answer.
This is the disadvantage of discussing previous question.
क्विज असं असतं, क्विज मध्ये ते लिंक पकडायची असते. तो परफेक्टली राईट डॉक्टर महेश, युअर स्कोर 10 marks. Yeah.
So let me ask one question here.
Yes, sir.
Which is the triad of TRMA, the thiamine responsive megaloblastic anemia? Actually, that word megaloblastic is missing here, obviously because you cannot reveal. So TRMA, when do you suspect TRMA? In a patient with? Any team can answer.
Sir, can I?
Yeah, Shilpa, go ahead.
Deafness, diabetes mellitus,
Wow.
and
Wow. This is perfect answer. Triad of congenital neurosensory deafness, megaloblastic anemia, and they have diabetes mellitus. Many of these children are treated with insulin, and they just don't respond. What you need to do is just give them thiamine. What will not disappear on treatment of thiamine?
Sensory neural deafness is not.
Yes, because it's irreversible. It has started in utero. The corticells, hair cells have been damaged.
So we're moving with the fourth question for the team Sickle. Are you ready, Mahesh sir?
Yes, sir.
Yes, is the spot for you on the screen. The bone marrow picture for you on the screen. Where to give the diagnosis. नितीश सरांनी डोक्याला हात लावलाय, पण ते खुश झाले, ते ओळखले त्यांनी.
नाही too tough.
Your time starts now.
Megakaryocytes, sir.
Large
megakaryocytes.
ठीक आहे, आपण आन्सर बघूयात. So the issue is a Gaucher cell in the bone marrow. So a difficult one. And here actually peripheral smear I have seen in one of the Nitin Shah sir presentation few months back in the Royal Tulip Hotel, Navi Mumbai. Ratri 11:30-12 वाजता तीन दाखवलं होतं. So thank you very much.
This is a large cell with an eccentric nucleus and a lot of debris inside, which looks like a cotton wool or a sea blue color, depending upon that you call it Gauchers or women.
So thank you, sir. So team Marathwada scored 20 marks ended up first round. So last team Western Maharashtra, team Megaloblastic. Are you ready?
Yes, sir.
Who is the team leader?
Shilpa ma'am.
Shilpa madam, I have to concentrate on you, right? Yes. So here's the first question on you on the dice for you. A 5-year-old child has multiple bruises on her extremities and oral mucosal bleeding of 3 days duration. She had mild respiratory tract infection 2 weeks before. Physical examination was normal apart from multiple ecchymosis and petechiae. Of the following, the next diagnostic step is option A, complete blood count, option B, prothrombin time, option C, bleeding time, option D, partial thromboplastin time, and E, anti-nuclear antibody titer. Your time starts now.
Answer is A, complete blood count.
Okay, the team leader has answered A, complete blood count. So let us confirm with our answer machine. Yeah, bingo, perfectly right. You are scored 10 marks. Sir, एवढा फक्त CBC एवढं महत्वाचं आहे का? पटकन लगेच डायग्नोस होऊन जातं त्याच्यावर.
Any child with a previous respiratory infection within 1 or 2 weeks develops purpura in a well child. You think of ITP and don't waste money on doing prothrombin time and APDT. Bleeding time is a completely waste paper basket test. It should not be done unless you are suspecting a platelet dysfunction. And ANA is not done even in a known ITP unless you have an adolescent girl who is not responding and becoming like chronic ITP. So only a CBC and a good peripheral smear examination should be enough.
Thank you, sir. So simple CBC.
So one subsidiary question to the winning team. What is immature platelet fraction? IPF.
It can be raised in conditions where like ITP, where eventually the marrow is not suppressed, so marrow is producing it. It's just like reticulocytes for RBC.
Absolutely. Where else it is useful besides ITP? One common clinical scenario.
Newborns.
No, in a child with fever, I will give a hint.
Yeah.
Can
with
we
a
answer?
maculopapular rash.
Dengue.
Dengue, yes,
Dengue.
right.
Okay.
Dengue, cherry, low platelet,
Yes,
IPM
yes.
is high. You know, next 2 days you will recover.
Yes. So there are 80 question the quiz and sir is adding 240 question into it. Thank you. So moving ahead with the second question. त्याच्याशीच तुम्हाला बोलवलं आम्ही एक्सपर्ट म्हणून. Second question, team ready? Which of the following disorder not associated with decreased RBC production? Option A, aplastic anemia. Option B, Diamond-Blackfan syndrome. Option C, hereditary spherocytosis. Option D, osteopetrosis. Your
शिल्पा
time
मैम सी
starts
लग रहा
now.
है क्या? शिल्पा मैम.
Hereditary spherocytosis. C.
Yes.
Okay. Team leader?
C. Answer C. Hereditary spherocytosis.
Spherocytosis is not associated with the decreased RBC production. So let us confirm with our answer group. Yeah, you are perfectly right. So, Nitin sir, ये बरोबर आहे ना हे?
Yes, so
Yes.
aplastic and Diamond-Blackfan both are marrow failure syndrome. Osteopetrosis, the marrow gets constipated because of the osteoclast overwhelming. So again, they have decreased production. So hereditary spherocytosis, there is increased production, but it can't be matched because there is peripheral destruction.
So, thank you, sir. Your point well taken. So, our time is less. So, we're moving ahead with the third question. High MCSC is not seen with. Options are A, sickle cell anemia, B, hereditary spherocytosis, C, iron deficiency anemia, D, immune hemolytic anemia. High MCSC is not seen. Your option starts now. Time starts now.
Deficiency anemia. C.
So team leader has confirmed with the C again. Iron deficiency anemia, high MCSC is not seen. Let us confirm again. You are perfectly right. Scored 10 mark. Congratulations. You are become Yuvraj Singh. It's your sixers. प्रत्येक तुमच्या आमच्या क्वेश्चनवर येते. Thank you very much. So moving to the fourth question for you. Spot.
Responding very fast.
Yes, थोड़ा fast जाऊँ यार. This is the peripheral smear for you on the screen, and please watch it 5-6 seconds, and your time starts now.
Rama.
मेगैलोब्लास्टिक लग रहा है.
Hypersegmented neutrophils. Megaloblastic anemia. Macrocytosis.
मैम आंसर बोलिए.
Okay. So megaloblastic is the answer from the team leader, right? So let us confirm.
Absolutely right.
Absolutely right.
Absolutely right.
उनका नाम ले लिया हो गया उनका काम.
40 out of 40. So
they've actually scored 60 out of 40.
So they have scored 40 marks. Congratulations.
Points.
So yes.
So after the round 1, we have the scores as follows. Anemia team Vidarbha is 20. Leukemia team North Maharashtra is 30. Thalassemia team Mumbai Konkan is 20. Sickle Marathwada is 20. And megaloblastic West Maharashtra is 40. So
Mega
West
score.
40. All other 3 teams with 20 and leukemia with 30. North Maharashtra.
Okay. So congratulations team megaloblastic leading after round 1. So before starting round 2, if your answer machine want to take some loo break, he always say कि मला काही break देख 2 मिनिटं. You can take. So I will go back to our experts. How we are going?
Any office bearers are there? Any office bearers there? Otherwise, any guest of honor is there. They want to comment or respond. Jay, you can ask them.
No, excellent. I think very well thought of question.
This is
and but I would also compliment the teams. I mean, they have really answered very well.
Very nicely. I think very fitting for the Anemia Day world.
So you are
Pinky, are you there now? Pinky?
Yes, sir.
Yeah. So
yes,
now
sir.
entire round 2, I will keep mum. You take over.
No, sir. Please
No, I'm trying there. Don't worry. But
No,
you take.
we love to listen to you. We love it.
No, it's okay. It's okay. You can do entire round.
No issue, sir.
Experts are always welcome. Sir, तुम्हाला all three experts, you can speak on all questions.
नाही ठीक आहे ना. आता आपण आपल्याला संपायचं
I
वेळ
think
ऑलरेडी.
I think you have been kind enough not to have many oncology questions, as I am having a severe sore throat and coughing.
Ma'am, actually, I was asked to prepare questions on anemia only. That is on 26th of December. I thought the quiz will be on the 26th. So I have prepared only questions on the anemia.
ऑन्कोलॉजी और गडबड होता.
मॅडम पण सेकंड राऊंड व्हायचं आहे ना. आम्ही हेमॅटो-ऑन्कोलॉजी लिहिली ना पुढे.
No, I am learning a lot from Nitin. I am listening to Nitin. I always love to listen to Nitin.
Yes.
Even sir's approach is always very practical. So even I learn always by sir. Like sir is thorough in his knowledge.
Oh my.
Crisp answers.
जय ऑलरेडी 1 तास आणि 10 मिनिट झाले.
Yes sir. पुढे पण जातोय. We are going the second round. Team Anemia.
फास्ट.
हा आता फास्ट होय. टीम विदर्भ.
Yes sir.
टीम अनिमिया विदर्भ.
Yes sir. Acknowledge करा. So Dr. Rafiq na?
Yes sir.
Yes, are you ready sir? So I have a question for you on the screen. Which of the following statement is false about the severe deficiency of vitamin B12? Options are: it presents as a macrocytic anemia, hypersegmented neutrophils in the peripheral blood smear, C, neutrophilic leukocytosis in CBC, D, can have CNS symptoms. Your time starts now. False.
About the answer is C.
C for cat?
Yes, C for cat.
Okay, I have registered that answer. Let us see the answer here. Yes, neutrophilic leukocytes are false. Rather, you get the leukopenia in the B12 deficiency. So, yes, Dr. Pinky?
Yeah,
he's
so
right.
as we all know that
Pinky, just 1 minute. I think request to all the team, when you say A, B, C, instead you read also the answers. So you say C, neutrophilic leukocytes. Then we know is no confusion.
Yeah.
Sorry,
Right.
Pinky, go ahead.
Yes, sir. Thank
so
you.
as we all know that vitamin B12 is very much important to make a nucleus. So all cells requires that. So usually in a vitamin B12 deficiency, we see pancytopenia rather than a leukocytosis. And the CNS symptoms, so we all know that subacute combined degeneration and ITS like symptoms we have in a B12 deficiency. So yeah, correct is a neutrophilic leukocytosis, which is not seen in a B12 deficiency.
Thank you, Dr. Pinky. So moving on to the second question for the team. A healthy 5-month-old boy appears pale. Examination is unremarkable. Life happenings includes HB 8.1 gram%, WC 4,800, platelet 1,44,000, mean corpuscle volume is 111. Blood film shows hypersegmented neutrophils. Serum B12 is 65 and low it is. So infant is vigorously breastfed. So of the following, the next step of management is: options: a performing shilling test, B, check serum B12 of the mother,
B,
C, parental admission of vitamin B12, administration of both folic acid and vitamin B12, E, transfer pack cell RBCs to the baby. Your time starts now.
The answer is C, parenteral administration of vitamin B12.
Okay, before revealing the answer, Pinky madam, are you there? Yes. So this is a baby with the B12 deficiency. So whether is difference between the infant with B12 deficiency and adolescent or healthy adult in B12 deficiency? So answer is somewhere. They have given the answer of parenteral administration of the vitamin B12 to the baby. But what was the first step? How to confirm it, right? Yes.
So
Babies
usually
babies,
exclusive breastfeed. So definitely deficiency comes from the mother only.
Yeah.
So we know that India is a country in which vegetarian mothers with less intake of milk is very common. So usually it's a mother deficiency of vitamin B12 and megaloblastic anemia, which lead to infant with a B10 deficiency. So it's very common scenario.
So
Yeah.
our answer is actually B,
B.
right? Confirm the answer. Check the B12 of the mother. That is the first answer, right? Thank you. So moving on to the third question here, team anemia. The single best predictor of favorable outcome in AML is the presence of which of the following? A. Ataxia telangiectasia, B. Fanconi anemia, C. Myelodysplastic syndrome, or D. Trisomy 21. AML चा पेशंट आहे आणि कुठलं फेवरेबल फॅक्टर यातला असू शकेल? Your time starts now.
C. The answer is C. Myelodysplastic syndrome.
So favorable is myelodysplastic syndrome. Let us confirm the answer from the answer machine.
No. No. Trisomy 21.
Actually, trisomy 21. Kurkure madam, Purna Kurkure madam, आपल्याकडे आलाय थोडा.
Yes.
Oncology. Are
Trisomy
we right?
21 is the correct answer. The other three conditions, 2, ataxia and Fanconi's, they have a genetic background,
Right.
and they require for their correction, means AML associated with them is not a good prognosis. And myelodysplastic syndrome is a disease of the whole of the not only of the myeloid lineage but also of the other lineages, stem cell, the real stem cell. So the trisomy 21 is a good prognosis which is associated in AML, and that is how we leave these children alone after the induction and consolidation. They are not the children who go for the BMT in first remission.
Okay. Thank you. Point well taken. So moving to the fourth question for the team anemia. A 12-year-old girl presents the progressive pallor, lethargy, fatigability, and on examination, apart from pallor, nothing is significant. But CBC showed this picture. What is the bone marrow diagnosis? Where do you go to the diagnosis only?
Megaloblastic.
Your time starts now.
Time starts now.
The answer is megaloblastic anemia.
Okay, the Dr. Rafiq, team leader said the megaloblastic. Let us confirm this answer from the answer machine. Yes, sir, you are perfectly right. It's a megaloblastic anemia. You have scored 20 marks at the end of the second round. Thank you very much, team Vidarbha. So moving on the team leukemia, North Marathwada ready? Team leukemia. Yes, sir, mana म्हणजे. Are you ready?
Yes, sir.
Yes, sir. Video on kara. Yes. Dr. Shamal, leader. Dr. Shamal, तुम्ही आहात?
Yes, sir.
Yes, sir. So this is the first question on you on the screen for you. आता आपण fast जाऊयात. Which of the following marker increase in megaloblastic anemia in otherwise normal child? Option are CRP, B procalcitonin, C cobalamin level, D LDH. Your time starts now.
Sir, our answer is D LDH.
Okay.
Yes, you are right.
Thank you. So all the congratulations. They have scored 10 marks. Second question for you. You are evaluating 7-year-old male child with cervical lymphadenopathy. The most likely finding that raise your suspicion of malignancy is option matted nodes, B fluctuant nodes, C fixed nodes, D presence of systemic symptoms, or E no regression in size of nodes to its normal within 2 weeks. Your time starts now. Malignancy suspected आहे आपल्याला patient मध्ये. Clinical question, clinical examination.
So our answer is C, fixed node.
Okay, let us confirm your answer in the answer machine.
No regression in the size of the nodes. E.
Yes, perfectly right. Our reference set is a fixed nodes can be a malignancy. We're moving on to the third question for you. Which of the following is not a disorder associated with defective iron utilization? Option A, sickle cell anemia. Option B, anemia of chronic inflammation. Sideroblastic anemia. Lead poisoning. Not a disorder associated with the defective iron utilization. Your time starts now.
Our answer is A, sickle cell anemia.
Okay, it's not associated with the defective iron utilization. I think let us confirm with our Hemant sir. Perfectly right. All other options are having defective iron utilization. You are perfectly right. Moving with the fourth question for you. Identify the abnormality on the peripheral smear. Name any, at least I written the four not, we have to name any one condition where these cells can be seen.
Anemia.
Your time starts now.
Sir, target cells are seen, and these are seen in iron deficiency, malaria.
Okay. So let us confirm the answer. Yeah, they are the target cells and it can be seen iron deficiency. So mark given to you. So at the end of second round, they have scored all sixers, 40 marks. Congratulations, team North Maharashtra. They are in the forms. Okay. So the team Thalassemia, Mumbai, ready?
Yes.
Let us, I don't know what questions are there for you, difficult or a soft one, or let us attempt it. Your question first for you on the screen. Identify the false statement about AIH, that is autoimmune hemolytic anemia. Options are: it presents anemia, jaundice, increased reticulocyte count. B is positive direct cum test. C, bone marrow aspiration study is the most important diagnostic test. And treatment includes immune suppressive therapy. What is the false about all these options? Your time starts now.
C, bone marrow aspiration study is the most important diagnostic test. That's false.
So confidently answered. ते बरोबर यायलाच पाहिजे असं वाटतंय मला. आता बघूयात आपण. Perfectly right. You have scored it. Thank you. Moving the second question for you. Which of the following is the best treatment for a 5-year-old girl with acute immune thrombocytopenia (ITP), platelet count of 30,000, and mild petechial rash all over body? Option A, IVIG. Option B, anti-D gamma globulin. Option C, corticosteroid. Option D, platelet transfusion. Option E, no treatment. Your time starts now.
No treatment.
Our answer is E, no treatment.
I think you are perfectly bingo. You have scored it. Congratulations. We got the third question for you. Patpat टाकून घेऊयात आपण. Rapid fire. Platelets are the direct fragments of the options: cytoplasm of the megakaryoblast, B, nucleus of the megakaryoblast, C, cytoplasm of the megakaryocytes, and D, nucleus of the megakaryocytes. Your time starts now.
Our answer is C. Our answer is C, cytoplasm of the megakaryocyte.
अरे बाप रे, एकदम मुंबई टीम फॉर्मात आली असं वाटायला मला. मॅडम लागून उलट बरोबर. सर, yes, you are perfectly right. Congratulations.
Thank you.
Okay. There is fourth question for you. A 10-year-old girl having ITP since 6 months had ecchymotic patches on her leg and has uncontrollable epistaxis. Her platelet count is 4,000. At least me tell at least 1 or 2 important investigation this patient, right? 10-year-old, ITP since 6 months, and ecchymotic and platelet count is 4,000. Time starts now.
Which 3 investigations?
आणि 20-3 नाही, तुम्ही 1-2 सांगितले तरी फार झाले. एक पण इम्पॉर्टंट सांगितलं तरी फार होईल.
ANA, because SLE could be a thing, and antibodies to platelets.
ओके लेट अस कन्फर्म ऍटलीस्ट एक मला वाटतं एक उत्तर तुमच्याकडनं आलेलं आहे ए ने बहुतेक बरोबर असणार आहे. लेट अस कन्फर्म यू शुड मस्ट रिलॉट एसएल इन दिस पेशंट. परफेक्टली राईट. तुम्ही दोन आन्सर मला पाहिजे ए आणि DSDA बरोबर आले तुमच्याकडनं. सो इट इज नॉट एन ITP म्हणजे काय त्याला इडिओपॅथिक नाहीये हे. इज सम सेकंडरी कॉज. सो कॉंग्रॅच्युलेशन टीम, यू हॅव स्कोर्ड 40 मार्क्स. कॉंग्रॅच्युलेशन. यू आर हॅपी?
Very, thank you.
Very happy. Okay. So moving on with the third next team.
Yes, sir.
Team Sikal.
Ready, sir.
Sir आहेत तुम्ही? Yes.
Right,
तुमचे
sir, right, sir.
काय म्हणाले पार्टनर आलेले आहेत. First question for you on the screen. In office practice, the distinction between thalassemia trait and iron deficiency anemia depends on the following test, except ह्याच्याशिवाय first LDH level, B RBC indices of the parents, CBC with RBC indices, or peripheral blood smear examination. Your option starts now.
A LDH levels. A LDH levels.
Okay, I have registered A LDH level because बाकीचे महत्वाचे आहेत. बहुतेक आन्सर तुमचं बरोबर असणार आहे. कॉंग्रॅच्युलेशन, आर परफेक्टली राईट. मूव्हिंग विथ द सेकंड क्वेश्चन. A 9-month-old boy appeared pale. Examination revealed palpable liver 3 centimeter, right costal margin, palpable spleen 4 centimeter. Lab findings include hemoglobin 6.4 gram%. Mean corpuscle volume is 67. WC count is 15,000 per 15,000. Of the following, the most valuable test to confirm the diagnosis is? Options are blood smear, option B serum iron, TIBC, or serum ferritin, C hemoglobin electrophoresis, B bone marrow examination, and E abdominal ultrasonography. Pale baby with hepatosplenomegaly and anemia. Your time starts now.
HB electrophoresis, sir.
Okay, so C option मी लिहिलेला आहे तुमच्यासाठी. तो परफेक्टली राईट असावा असं मला वाटतंय. Yes, perfectly right. Congratulations. We move to the third question for you. Each bodies are made of excess gamma chains, excess alpha chains, excess beta chains, none of the above. Your time starts now. Each bodies. द्या काहीतरी आन्सर. टाइमर स्टॉप होतोय. एक तुक्का होऊन जाऊ देत पटकन.
बीटा चेन.
ओके, सी एक्सेस बीटा चेन. पण अल्फा बीटा असतं ना आपल्या ह्याच्यामध्ये. बघूयात आपण काय आहे. आन्सर मशीन actually is alpha chain. Thank you. Not able to get the correct answer. Okay, next question for Team Sikal. फक्त हेमॅटोची कंडिशन ओळखायची आहे. काय असणार ह्या अशा पेशंट असल्यानंतर? त्याला अॅनिमिया पण आहे. ओनली वन, आय वॉन्ट ओनली वन डायग्नोसिस बस. पॉलिडक्टिलिटी आहे, अॅनिमिया आहे. टाइम स्टार्ट्स नाउ.
Fanconi's anemia, sir.
Okay, I will write it because you have answered it and they perfectly right आहे. It is Fanconi's anemia. Congratulations.
Thank you.
Yeah, perfectly right. त्याच्यामध्ये MDS आणि AML कॉमन असतं. So congratulations. So team megaloblastic, they are waiting for us.
30.
They are scored
30 marks.
30 marks. Thank you. चला पुढची टीम. Team megaloblastic are ready. So team leader, I will concentrating on you. Hi म्हणा जोरात. चालेल. This is the first question for you on the screen. Identify the most important test for iron stores. Options: serum iron, serum ferritin, TIBC, transferrin saturation. Your time starts now.
Answer B, sir, serum ferritin.
Okay, you have written the answer. चला आपण लगेच Timer जरा fast पळवलं तर चालेल. Perfectly right. Your second question for you on the dais. You are evaluating a 5-year-old male child with multiple ecchymosis distributed all over the extremities and trunk. Examination reveals palpable spleen 3 cm and the lab findings include hemoglobin 11 gram percent, white cell count 8,700, platelets counts 21,000. And of the following, the most proper next step is options: bleeding time, B option coagulation profile, C platelet aggregation test, D abdominal ultrasonography, and E bone marrow study. Your time starts now.
रमा
मैम मुझे ई लग रहा है.
मुझे कोएगुलेशन प्रोफाइल लग रहा है.
Timer. Option. Patkan.
मैम आंसर
Answer A, bleeding time.
Okay, I written the answer A. This is a patient of hepatitis splenomegaly with ecchymosis, 5-year-old. Let us sign platelet count पण कमी आहे. So let us confirm the answer. Actually, answer is bone marrow study. Team member ने दिला होता बरोबर पण ठीक आहे. It's okay. चलो, very important. ठीक है. You are not scored this time. Question 3 for you. Prognostic indicator as the diagnosis in acute lymphoblastic leukemia ALL includes age and biologic property of the leukemic blast. Which of the following is another prognostic indicator at the diagnosis of the ALL? Options are A, gender, B, presence of Down syndrome, C, presence of fever, and D, initial white blood cell count. Prognostic factor in patient of ALL. Your time starts now.
Sir, D, initial white blood cell count.
Let us confirm. Timer fast forward taka. Yes, you are perfectly right. Bingo is very, very important. So moving on the fourth question for you. I want only diagnosis. 1.5-year-old boy with minor injury develops this type swelling. Right. What investigation will advise? Diagnosis and investigation.
मैम ये मुझे थोड़ा हीमोफीलिया वगैरह जैसा लग रहा है.
Hemophilia.
Investigation, PTPTT and
Factor assay and PTT.
Okay.
Seems like hemophilia.
Okay. So let us confirm.
Mode of inheritance is X-linked.
Let us confirm. Answer machine. Sir, Hemant sir. Yes, PTPTK hemophilia A or B. You are perfectly right. You scored 10 marks. So at the end of the second round, they have scored 30 marks. Hemant sir.
Yes, 30 marks.
So एकदा स्कोर सांगा आपण रॅपिड फायर ला जाऊयात. रॅपिड फायर साठी टीम विदर्भा प्लीज या डायस वर एकदा राउंड स्कोर सांगून टाका टोटल.
Just going to the scores. Team Anemia Vidarbha 20 plus 20 total 40 after round 2. Leukemia North Maharashtra 30 plus 40 total 70 after round 2. Thalassemia team Mumbai Konkan is 20 plus 40 it is 60. Sickle Marathwada it is 20 plus 30 50. And Megaloblastic West Maharashtra is 40 plus 30 70.
So
leukemia and team Megaloblastic are at 70 each, and then thalassemia is at 60. Rest of it is 50 and 40.
Yes. So we are moving ahead with the rapid fire. Team Vidarbha Anemia ready आहेत तुम्ही?
Yes,
Rafiq sir.
Yes, sir.
Rapid fire only one person should answer. 6 प्रश्न टाइम खतम होण्यापूर्वी टाइमर संपेपर्यंत 6 क्वेश्चन आले की प्रश्न भेटला आपला. So are you ready? आणि most important thing, you should answer something or say pass. Then second question will be posted on the dais, okay, on the screen. The time starts now.
Dr. Jay, I will request Dr. Neha and Dr. Amol to just note down what answers they're answering. So at the time of question, just tell right or wrong. Okay. So and Neha, Dr. Neha, both of you just pay attention what answer they give and just make a note of it. Okay. So just we move for this team Anemia.
Yes.
And 1 minute, huh? 1 minute. So your time as well as question starts now.
Anemia due to deficiency of iron or B12 can be differentiated based on the exhaustion of blood cells. True or false?
True.
Erythropoietin cannot cross placenta. True or false?
False.
Neonatal red cells have a larger cell volume. True or false?
True.
What is the normal blood volume of term newborn? Value.
80 ml per kg.
What is the therapeutic dose of parenteral B12 in megaloblastic anemia?
125 to 250 micrograms per kg.
In megaloblastic anemia, which electrolyte is associated with the treatment with injection B12? Let you fast.
Potassium, serum potassium.
Okay. Let us confirm their answers.
So just we'll go to answers and just tell me, Dr. Neha, tell me it is right or wrong. Huh? Okay, whether they have answered.
Yes, sir.
Chalo, bolo. First.
Anemia, yes, the answer correct. True. Barobar ahe? Yes.
Yes, sir.
And the second answer, they are said
False.
okay. So only one correct answer. Neonatal red cells, they are said true.
Yes, sir.
दो सेकंड और ये 80 ml पर केजी वो भी दे देगा. थर्ड तीसरा भी करेक्ट है. पांचवा आया नहीं था आंसर. 125 समथिंग बोला था और लास्ट भी करेक्ट है. तो दे आर करेक्टली सेड 5 4 okay. They have scored 20 marks. Congratulations team Anemia.
Right.
Okay.
Confirm enough. Dr. Neha, you confirmed the answer. No?
Yes, sir. They have scored 20.
Okay. So
Neha,
next team
Dr. Jay, Dr. Neha, you are going to take the answers and telling how many are right. Okay. So just pay attention to that. Okay.
So team Leukemia North Maharashtra आहे ready आहेत तुम्ही? Video audio on.
Yes, sir.
Yes, sir.
Video on करा ना. Video बंद आहे तुमचा.
Yes, sir.
Acknowledge.
Okay. This you're ready. So your
Yes, sir.
rapid fire starts now.
Yes,
So team Leukemia, your time and question starts now.
Which anomaly in human associated with the folate deficiency in first trimester of pregnancy?
Neural tube defect.
Goat milk deficient in which vitamin may head to which anemia?
Folic acid, megaloblastic anemia.
Hemoglobin F consists of 4 globin chains. Name them.
2 alpha and 2
2 alpha and 2
2 alpha, 2 beta.
No, 2 alpha, 2 gamma.
Sorry, 2 alpha and 2 gamma. Sorry.
In beta thalassemia major is a quantitative defect of HB synthesis. True or false?
Quantitative.
Quantitative.
Sorry,
Qualitative.
qualitative.
Qualitative. False.
False.
Iron absorption occurs predominantly in which part of gastrointestinal tract?
Gastric
Stomach.
stomach.
Stomach mucosa.
Most important iron binding protein in plasma or oblique circulation is 90% of iron binding protein.
Globulin.
Okay, let us confirm the answers.
So Dr. Neha, you are going to respond whether they answered right or wrong. Huh?
Yes,
So these are the answers.
Qualitative आहे, thalassemia quantitative.
Neurotic bed बरोबर आहे. Folic acid बरोबर आहे.
हे नाही देणार त्यांनी पहिले 2 अल्फा 2 बीटा बोलले पहिले. फर्स्ट
हो
आन्सर
नाही पहिले दोन बरोबर आहे. तिसरा रॉंग आहे.
हे सगळे रॉंग आहे.
बाकीचे सगळेच रॉंग
चारही
आहेत.
wrong
बरोबर आहे.
आहे.
सगळे रॉंग आहेत. तीनच बरोबर आले.
Yes, sir.
दोनच.
दोन.
Sir, third वाला भी correct है ना sir?
नहीं, आप पहले अल्फा 2 बीटा 2 बोल दिया.
Sir, we change किए.
Final answer.
Next question आने के पहले change किया था.
Sir, next question के पहले change कर दिया था.
एक बार एक लड़की को हाँ बोल दिया शादी में तो बाद में चेंज नहीं कर सकते ना.
आजकल कर सकते.
चलेगा दीपिका आप लोग चलेगा.
चलो आगे next team thalassemia.
Dr. Jay, so they have scored 10 marks.
10 marks. चला पटपट चला फास्ट आहात. गोकर्ण मॅडम रागाने बघतात माझ्याकडे. तुम्ही रेडी, तुम्ही आन्सर देणार ना आता सगळे?
हो हो
हा, तुमच्यावर लक्ष देणार. ओके आता ते आमचे
हा
मशीन
नाही
चालू
नाही, मी
झाले.
सांगतो ते. तर युअर टाइम अँड क्वेश्चन स्टार्ट्स नाव.
In patients with thalassemia major, nascent RBC destroyed before they leave bone marrow cavity. This is called as
ineffective erythropoiesis.
antacid therapy may lead to inadequate iron absorption. True or false?
True.
Which blood test you order while suspecting celiac disease in a child with IDPC anemia?
TTG, anti-TTG.
Most common basic infestation in media responsible for the GI gastrointestinal blood loss in IDPC anemia in children.
Giardiasis.
Okay. Give one toxin or drug name. They lead to acquired sideroblastic anemia.
Phenytoin.
Give full form of G6PD.
Glucose 6 phosphate deficiency. Dehydrogenase. Glucose 6 phosphate dehydrogenase deficiency.
नहीं नहीं, अभी हो गया.
Let us confirm the answer.
Dr. Neha, just check it out.
1, 2, 3.
Ineffective बरोबर आहे. एंटासिडचं ट्रू म्हणाले ना ते. हो बरोबर आहे. तिसरा पण बरोबर सांगितलं मला वाटतंय.
हो.
हे जीआरडीसीस बोलले ते.
हा ते रॉंग आहे.
ते रॉंग आहे.
आणि
लेड नाही सांगितलं.
सिडरोब्लास्टिक पण रॉंग म्हणा. ते काहीतरी
फेनिटॉइल में है क्या? लेकिन सर फेनिटॉइल में हो सकता है सिडरोब्लास्टिक?
Yes.
नहीं नहीं नहीं
नहीं ना, ठीक है. तो आरएच में होता है. ठीक है, तो कितना 3 बराबर आया?
3 बराबर. लास्ट वाला ग्लूकोज 6 फॉस्फेट डेफिशिएंसी.
Dehydrogenase. वो देने का.
नहीं देने का.
नाही, अभ्यास आमचे एक्सपर्ट डिसाइड करतील काय करायचं.
Yeah. So नितिन को पूछो.
नहीं, so I think, see, when you say 2 alpha 2 beta and 2 alpha 2 gamma, they are completely different answers. G6PD to complete dehydrogenation second item, I think should be given.
ओके, ठीक है. तो 4 बराबर आ गए.
4
90. ठीक है, चलो. फोर्थ टीम
देने का है.
हाँ, देने का. वो आर जनरस. टीम मराठवाडा सिकल.
यस यस.
अच्छा, महेश सर आला है. तुम्ही रेडी आहात?
आहेत.
हाँ.
So your time and question starts now.
What diagnostic blood test you order while suspecting hemoglobinopathies like thalassemia or sickle cell anemia?
HB electrophoresis.
Give full form of HbA1c. काहीतरी आन्सर द्या, नाही तर पुढे पास म्हणा. Hemoglobin A consists of which 2 globin chain?
Alpha and beta 2. Alpha 2 beta 2.
What is normal HbA2 level in pediatrics?
Less than 3.2%.
Which cause Eldridge syndrome is autosomal recessive? True or false?
False.
Aplastic is usually macrocytic. True or false?
True.
So let us come with Dr. Neha.
Wow, they score all 6.
Yes, sir.
इलेक्ट्रोफोरेसिस बरोबर आहे पहिला.
सेकंड
नाही आलं त्याला.
HbA1c नाही आलं, ठीक आहे. अल्फा 2 बीटा 2 बरोबर आहे.
बाकी सर्व त्यांनी बरोबर म्हटलं मला.
तिसरा चौथा बरोबर आहे.
हो.
आणि बिस्कॉट लेडीज मध्ये फॉल्स म्हटले, बरोबर आहे.
5 मिळाले 6 पैकी.
5 मिळाले, ठीक आहे. 25.
व्हेरी गुड.
व्हेरी गुड. टीम मराठवाडा, तुम्ही मस्त सिकल, तुम्ही चांगलाच कोयता चालवला आता, व्यवस्थित अगदी. कॉंग्रॅच्युलेशन.
थँक्यू सर.
येस, मेगालोब्लास्टिक. आता तुम्हाला फाईट द्यायची आहे. तुमचे 70 आहेत आणि तुमच्या हेड आहेत 85 ना.
नाही, नॉर्थ महाराष्ट्र 80 आणि थॅलेसेमिया 80 आहे.
हो, 1885 आहेत, बरोबर आहे. तुम्हाला 4 कमीत कमी दिले तरच मी पुढे जाणार. येस, आर यू रेडी?
80-85 ना 80-80. येस.
टू क्रॅक 4 दे विल बी विनर, राईट? आर यू रेडी? कोण आन्सर करणार आहे? एकानेच आन्सर करा म्हणजे तुम्ही सगळे छान अटेम्प्ट करू शकणार. लीडर
Yes, sir.
ओके या. So
your time and question starts now.
acute chest syndrome, vaso-occlusive crisis, painful crisis are seen in which anemia?
Sickle cell anemia.
You have 3-year-old child with a newly diagnosed sickle cell anemia. Which medicine will start to decrease the HbS level?
Hydroxyurea.
Which virus commonly associated with aplastic crisis in sickle cell anemia?
Parvovirus.
Which vaccine are specially indicated in sickle cell anemia patients? Name at least 2.
Pneumococcal, meningococcal, and H influenza B.
Which cancer is associated with the persistent hematuria in sickle cell trait patients?
AML. AML.
पुढचा प्रश्न 6वा आहे ना. HB Bards 4 gamma globin chains associated with which anemia syndrome?
Alpha thalassemia. Major.
Okay, let us confirm the answer. बापरे, जोरात बॅटिंग केलेली आहे.
Dr. Neha बघा जरा आणि sir also is there. So these are the
Special Maharashtra, you can smile please. टेन्शन मध्ये फार दिसू नका, हसला चालेल.
मला वाटलं सर्व येते.
First answer is correct, second is also correct, third is also correct, fourth is also correct, fifth is not answer, and last is perfectly correct. So they have scored 25 marks.
1, 2, 3, 4, 5, 25. Okay.
चला आता आमचे हेमंत गंगोलिया सर फायनल रिझल्ट डिक्लेअर करतील.
So before we declare the results, any experts want to make the comment, and then we will proceed to the final declaration of the result.
I will just say that I also learned some Hemato-Oncology today.
कुछ भी नहीं. कुछ भी.
Dr. Pinky.
Yeah, such a nice experience. This is the first time I'm attending any quiz online, but I thoroughly enjoyed. Really nice teaching experience.
I think also congratulations to Pinky for taking all the trouble to make this question. It's
Thank
so
you so
boring
much, sir.
otherwise.
पर डॉक्टर नितिन शाह क्या बोलूं मालूम है क्या, ये मैडम ने सब क्वेश्चन हाथ से लिख के दिए, हम लोग को टाइप करना पड़ा.
Sir, I just want to tell you that Dr. Amol Pawar has given me 24 hours to prepare all the questions.
No, okay. Just joking.
इसलिए वो माइक्रोसाइटिक का नियोसाइटिक होता था सब जगह पे स्पेलिंग.
Purna madam.
Yes, no, I learned a lot in anemia. And I'm glad that I revised my anemia chapter.
So going with the results, and officially Dr. Nitin Shah sir and Purna madam will declare. But just to declare the results, first I will tell the team anemia, which is team Vidarbha, round wise 20, 20, 40, 20, 20, 20, total 60. Then Dr. Neha, just keep a watch. If I'm wrong, correct it me. The team leukemia, team North Maharashtra, 30, 40, and 10. That makes 80. Thalassemia, Mumbai Konkan, it is 20, 40, and 20. That is 80. Then sickle team, Marathwada, 20, 30, and 25. That makes 75. And last, megaloblastic team West Maharashtra, 40, 30, and 25. So that makes it 95.
Wow! Congratulations.
So the winner is team megaloblastic with 95, and runners are North Maharashtra and Mumbai Konkan thalassemia and leukemia team with 80.
Congratulations to all of you.
That was fun.
Thank you, sir.
Thank you for
Can I
inviting.
say something?
So
I think
Dr.
May-
Anjali,
I
we will
think-
take
thank you.
one comment from from each team. Only 1 or 2 lines, please. Be fast. So we will just ask first team Vidarbha.
Yes, sir. It was fun and we learned a lot. Thank you very much for including us.
Team Marathwada. Team Marathwada.
Mahesh sir.
Yes, sir. काही नाही सर, 2 दिवसात फुल रिव्हिजन झालं सर.
Team North Maharashtra.
So it was very exciting session. We learned a lot.
Actually, we were firstly nervous. We thought we will not get anything, but we are happy that we answered some questions.
Looking at the Dr. Nitin Shah, Dr. Punna madam, anyone will get nervous. Then I will ask the Mumbai Konkan, Dr. Anjali.
Yeah, I must thank the experts, especially Pinky. This is really a mammoth task to prepare a question bank. Thank you very much. Thank you, Nitin, for being there throughout.
Thank you.
And Dr. Purna ma'am. Last 2 days, I have read as much hematology I have never read in 20 years.
Good stimulus.
It was great fun.
And last comment from the winners of this today's quiz, West Maharashtra, megaloblastic, please.
अमोल सर म्हणाले म्हणून आम्ही यात आलो. 2 दिवस नेल्सन वाचत होतो, खूप छान वाटलं. खूप दिवसांनी नेल्सन वाचलं पुन्हा एकदा आणि जरा कॉन्फिडन्स बूस्ट झाल्यासारखं वाटलं यात आल्यावर.
शिल्पा मॅडम एक विचारू का? डॉक्टर अमोलनी क्वेश्चन्स लीक तर नाही केले ना काही?
Actually, today I was planning to call it. Sir, थोडे nearby ला थोडा consider करा.
सर आई शपथ.
जोकिंगली.
नॉर्थ महाराष्ट्राला लीक केले असते ना, केले असते तर.
त्याच्यामुळे डॉक्टर पिंकी मॅडम वी चेंज सम क्वेश्चन. Okay, so thank you very much everybody. Now I will ask Dr. Amol to have this any comments as well as vote of thanks, as well if you want to say anything. And lastly, we end with the comment from the Jay Bhandarkar state convener. Before that, Dr. Neha, you want to say anything? She is the person who is after all fire, all messages, all draftings, and all that time. So, Dr. Neha, 1 or 2 lines from you. Then we will go to Jay. You want to say anything? And lastly, we will end up with the Amol. And if experts want to intervene in between, they are always welcome. Yes, Dr. Neha.
No, so I would, before that, I would just say that the actual winners were all those who listened to this question answer, the participants beyond the quiz participants, because they would have really learned a lot how to participate, what gain knowledge, etc. I hope it changes their practice from tomorrow.
Yeah.
This is really enjoyable. Learn with the fun. That is the way I would put it. Otherwise, it is so boring to read and practice hematology for a practicing pediatrician as to how they would face the cases on a day-to-day basis.
So, madam, when COVID struck us and when we came out of COVID, we started quiz, and that was our tagline: learning with the fun. So myself and Jay started with that, and the tagline was learning with fun. Thank you, madam.
So I think for the next time, if not time constraint, we'll prepare more of a clinical questions rather than a theoretical one, I guess.
Yes, Dr. Pinky, actually because we had very small, short time span, otherwise we devise the questions theme-wise, theme-based first question to all team will be same. Then all the practical scenarios, but we didn't get the time to do that. So extremely sorry for that, but still we managed to do whatever because of Dr. Pinky. Thank you very much.
Very good, very good.
Yes. So
Neha.
Dr. Neha and
Neha.
Jay and then Mamu.
Thank you so much, sir, for this quiz competition. I was a part of it. I really enjoyed for last 2 days preparing all the draft and everything. And today also it was a very much fun. Thank you, sir.
Jay.
Yes, thank you very much. Actually, question bank फक्त आली होती, तरी बरेच क्वेश्चन त्यातले चेंज केले, काही केस बेस टाकले, इवन पेरिफेरल स्मिअर असे. ठीक आहे, वी गट लेस टाइम अँड ऍक्च्युअली अजून फार चांगलं करता आलं असं मला पर्सनली वाटलं, पण ठीक आहे, इट्स ओके. नेक्स्ट टाइम विल डू मोर बेटर. सो एक 15-20 खरं तर फार चांगलं स्टँडर्ड अजून केस बेस करायचं असेल तर ऍटलीस्ट 10-15 दिवस पाहिजेत व्यवस्थित, सो दॅट टू प्रिपेअर द. प्रिव्हियसली काय केलं होतं, जे केव्हा केलं होतं पहिल्यांदा, आय हॅव टेकन व्हेरी म्हणजे न्यूरोलॉजिस्ट, नेफ्रॉलॉजिस्ट, पण मल्टिपल क्वेश्चन ते प्रॅक्टिसिंग प्रीमियर लीग कुणी जर बघितलं असेल तर पूर्ण पॅडिक्स होतं. तर मी सगळ्या 15 एक्सपर्ट्सला त्यांच्याकडनं क्वेश्चन्स मागवले होते. त्यामध्ये अँबिग्युटी त्यामध्ये काही आली नाही आणि फॉर ऑथेंटिक क्वेश्चन्स. पण ठीक आहे, स्टील आय थिंक इज अ थॉट प्रोवोकिंग. आता तुमच्यासाठी तयार करताना बेसिक क्वेश्चन बँक आल्यानंतर ते प्रत्येकाला डिस्ट्रीब्यूट करणं, तयार करणं, त्यातल्या मिस्टेक्स काढणं आणि थोडा बहुत ऍडजस्ट करणं. खरं तर हे बेसिक मी पीपीटी मी तयार करतो. क्वेश्चन सगळे आल्यानंतर काही ऍड करतो, काही डिलीट करतो, काही थोडं ऍडजस्ट करतो, काही केस बेस असं. नंतर फायनल ऍक्च्युली पीपीटी मी देतो गंगुले सरांना. आणि आम्ही जे सगळं तुम्हाला म्युझिक आणि सगळं दिसतंय टायमर तिकडनं कट करून आम्ही स्वतः शिकलेलं आहे ते अॅनिमेशन करणं. ऍक्च्युली ते वेळ जातो, पण आय थिंक लेक्चर पेक्षा काय छान वाटतं. बिकॉज मी लक्षात आलं असेल की स्टार्ट फ्रॉम अॅनिमिया प्री मॅच्युरिटी टू अप टू म्हणजे ल्युकेमिया एमडीएस आणि काय आपण सगळं डिस्कस केलं. सो अँड दॅट आय थिंक आय ऑलवेज से की यू कॅनॉट रिमेंबर एव्हरीथिंग, but you get that thread of the stimulus, right? You can go on reading and confirm. Patient बघितलं तर मग काहीतरी वेगळा विचार करू शकतो त्यामध्ये. So thank you very much all of you for learning and happy faces even after this quiz at 11 o'clock. Everybody is hungry. माझं तर अजून डिनर राहिलेलं आहे आज. मी तर होतो दिवसभर असं ते करते. थँक्यू व्हेरी मच आणि थँक्यू अमोल. अमोलचा फोन आला की सर अॅनिमियावर क्विज करायचं वेळ तो अगोदर गंगुल्यांना विचार, मग आपण करू. कारण ऑलरेडी वी नो दॅट महाआयपीने आपलं सगळं कंपाईल करून आपला जे काही 500 ऍक्टिव्हिटीज झालेल्या आहेत त्या CIP-ला आपण 30 तारखेला सबमिट केले आहेत. आणि तुम्ही बघील की we met the center IP level, we may get the first prize. And because in all of you people were responding in well all the programs and attending all the very enthusiastically. Thank you Raj. आणि क्विज मास्टरना काही मार्क्स द्यायचे असतील आणि थोड्या बहुत मला झाप मिळतोच आहे पहिल्यापासून, तरी मला फार खेळीमेळी झाला असं मला वाटतं. फार चुका नाही
जय जय चांगल्या खेळीमेळी झालाय.
प्रत्येकाला रिव्ह्यू साठी आपण पाठवणार.
Dr. Amol, खेळीमेळी झालाय. Dr. J, to whatever Jay said, usually what we do, suppose we have experts of 3 today, na? So what we say, Dr. Nitin Shah, you give just question set of 10 for us. ऐसा लोग करते हैं. तो ऐसा होता है. But anyway, it's good. Yes, Amol. टाइम झाला आपलं. चला बोल जय अमोल. येस अमोल.
माझा आवाज येतोय का?
हा येतोय.
चला बोला.
येतोय ना? हा. सर्वप्रथम
म्यूट झालास.
सर्वप्रथम 11 वाजले तर जे एक्सपर्ट्स, आवाज येतोय सर माझा? मी कंटिन्यूअस बोलतो आता, जेवढं ऐकू आलं तेवढं. सर्वप्रथम 11 वाजत आलेले आहेत आणि जे एक्सपर्ट्स डॉक्टर नितीन शाह सर, पूर्णा कुरकुरे मॅडम, अतिशय बिझी लोक ही, आणि या लोकांनी आपल्यासाठी 2 तास कंटिन्युअस त्यांचे 2 तास 2.5 तास दिले, तर त्याबद्दल त्या दोन्हींचे सर्वप्रथम धन्यवाद. डॉक्टर संतोष सोन सर आले आणि त्यांनी पण जवळ अर्धा पाऊण तास त्यांनी आपल्या बरोबर थांबले ते, तर त्यांनाही गेस्ट ऑफ ऑनर रिक्वेस्ट ऍक्सेप्ट केली, इन्व्हिटेशन ऍक्सेप्ट केलं, त्यांचेही धन्यवाद. पिंकीने 1-2 दिवसाच्या अंतरात क्वेश्चन बँक दिली, तर तिचेही धन्यवाद. मी सर्व ओबीज जे आहेत, सर्व ओबीजने मेहनत, म्हणजे सर्व ओबीजने बाकी टीम म्हणजे सेक्रेटरींनाच मी मेनली फोन केले आणि काही प्रेसिडेंट्सला, तर त्यांनी टीम तयार केली. टीमचे 2 इतर नावं दिले किंवा मला इतरांनाही फोन केले मी, आणि ती टीम पण दिली त्यांनी, तर त्यांचेही धन्यवाद. फक्त ही क्विज शेवटच्या 3 दिवसामध्ये टीम तयार केली, कारण मागच्या महिन्यात अँटीबायोटिक अवेअरनेस वीक, नंतर न्यूबॉर्न आणि सर्वात महत्वाचं महापेडिकॉन, ह्या कामामध्ये पूर्ण टीम महाआयपी पण व्यस्त होती. आणि नंतर शेवटच्या 7-8 दिवसात गंगोल्या सर, नेहा अतिशय व्यस्त होते पूर्ण रिपोर्ट तयार करण्यात, आणि रिपोर्ट सेंट्रल IIP ला इन टाइम आपल्याला 30 तारखेपर्यंत सबमिट करायचा होता. आणि गंगोल्या सर इतके टेक्नोसेवी आहेत, तर त्यांनी रिपोर्टिंग करताना म्हणजे अक्षरशः ओपीडी 1 ते 2 दिवस त्यांना ओपीडी कॅन्सल करावी लागली त्यासाठी. तर मी सरांचे धन्यवाद देतो. आणि पूर्ण तुम्ही जे आज क्विज मध्ये जी एंटरटेनिंग क्विज होती, जय भांडारकर सरांमुळे जी एंटरटेनिंग क्विज झाली आहे आपली, त्यात एकदम फुल फ्लेजली, म्हणजे मी तर माझे टीचर जे माझे सिनियर आहेत 5 बॅच प्रवराचे, डॉक्टर महेश भातांब्रे, तर एकटे खेळाडू होते त्या टीम मध्ये, तरी सुद्धा ते डगमगले नाही आणि त्यांनी पूर्ण केली. मी त्यांना मध्ये फोन केला की तुमच्या पार्टनरला बोलवा, टीम मेंबरला बोलवा, पण तरी ते स्वतः शेवटपर्यंत पूर्ण क्विज त्यांनी अटेंड केली. श्यामल असो, निशात असो किंवा वेस्टर्न महाराष्ट्राचं तर काय आता, म्हणजे फक्त क्वेश्चन यायचा आणि ते पटापट आन्सर द्यायचे. आणि अंजली मॅडमांनी आणि मेन सर्व लोक, मॅक्झिमम लोक हे एका डिव्हाइस वरनं जॉईन झाल्यामुळे ही क्विज अजून जास्त एंटरटेनमेंट क्विज मध्ये जास्त आली. तर मी सर्वांचे धन्यवाद देतो आणि एक्सपर्टचे परत एकदा धन्यवाद देतो. नेहा, विशाल यांनी जी मदत केली, पल्लवी मॅडम, या सर्वांनी जी मदत केली, तर त्याबद्दलही त्यांचे धन्यवाद देतो. आणि अजून कोणाला बोलायचं असेल तर बोलू शकतात. मी टीम महाएपी तर्फे पूर्ण वर्षभरात जे ओबीजने मदत केली, पूर्ण ब्रँचेसच्या ओबीजने मदत केली आमच्या टीम महाएपीला, आपल्या टीम महाएपीला, तर सर्व ब्रँचेसचे ओबीज, सर्व महाएपीएन्स, सर्व सेंट्रल आयपीचे जे पदाधिकारी आहेत, सर्व एक्झिक्युटिव्ह बॉडीचे जे मेंबर्स आहेत, महाआयपीचे जे एक्झिक्युटिव्ह बॉडी मेंबर्स आहेत, ओबीज आहेत, त्या सर्वांचे, त्यांच्या फॅमिलींचे, त्या फॅमिलीने त्यांना अलाउ केलं टीम महाआयपीला वेळ देण्यासाठी, तर त्या पूर्ण फॅमिली मेंबर्सचे मी धन्यवाद मानतो. थँक्यू वन अँड ऑल. कोणाला बोलायचं असेल तर प्लीज बोला.
अरे अमोल, ते विनर जरी राहिलोच म्हणतात, मग आमच्या सर्टिफिकेट प्राइस कधी भेटणार?
ते सरप्राईज महाआयपी सेक्रेटरिएट वरनं सरप्राईज मिळणार आणि 100% मिळणार पुढच्या महिन्याभराच्या आत.
आणि रनर्सअपला
रनर अप सर्वांना मिळणार मॅडम. रनर अपला पण
अमोल एक्सपर्टला विसरू नको.
आणि नितीननी जसं सांगितलं तसं एक्सपर्टला विसरू नको.